Hello, I'm Dr. George Lundberg, editor-at-large for MedPage Today, and we're in Chicago, Illinois, at the annual meeting of the American Medical Association. And right now, we have the great pleasure of being able to introduce you to Dr. Peter Carmel, the just now elected president-elect of the AMA. Thank you for being here with us.
Well, thank you, George. It's a pleasure to be here.
How does it feel?
Scary.
Scary.
Oh,
okay.
yes, absolutely.
Expand on that. What do you mean?
I think that there is a responsibility in representing the AMA nationally, which is essentially what the president-elect does. And I want to make sure that I get our message out. And our message is going to be a somewhat different message than it has been over the last 4 or 5 years.
Okay, well, Dr. Carmel, I neglected to say, is a pediatric neurosurgeon who practices in Newark, New Jersey, while living in New York. You won a tough campaign, a tough race. Tell me about your opponents. Who were they and how did they do?
Good. Well, they did wonderfully.
Okay.
It was historically unprecedented to have 3 candidates running for president-elect.
Okay.
All 3 coming from the Board of Trustees.
Okay.
All 3 having been involved in formulating AMA policy over a number of years. Dr. Heyman is an obstetrician and gynecologist, solo practitioner from Massachusetts.
Right.
And Dr. Ed Langston is a family practice, member of a large family practice group from Indiana.
Why do you think you won?
I think I won because I was very pro-doctor.
Okay.
Doctors are unhappy.
I heard that from other people.
Yes, because they feel that the new healthcare law, which has great things in it for patients, has very little for doctors. And none of the objectives that doctors had in mind got into the bill.
And yet, from what I've heard, there were no candidates for the Board of Trustees running on a platform of repeal and replace. Is that correct?
That is correct. I think for a number of reasons. Politically, repeal and replace is a hard thing to do. The truth of the situation is that it's going to take 67 votes in the Senate to override a presidential veto. Yeah. I think the president is very tied in to what has been gained in this new law. And so I'm not sure repeal and rescind is a realistic political goal.
Well, I felt the same way, but I was interested in recognizing that no one ran on a platform like that, even though I've heard for the last many months from doctors all over the country how unhappy they are about so many things. But you're going to effort making them less unhappy by trying to get the administration and the Congress to treat doctors a little better than they have been.
Well, get the administration to treat doctors better, maybe not the right term for it. But the fact is, George, that we have never passed major social legislation in this country, Social Security, Medicare, that wasn't tweaked a number of times in the ensuing years. And the tweaks in this particular law are going to continue for some time and probably will be most prominent after the next presidential election in 2013.
Right, and of course, tweaks can happen before most of the law gets actually implemented anyway, since there's this long fuse in front of many things being implemented.
Right. Most of the good things for patients in the law are front-loaded.
Right.
So patients will see this year and the following year most of the important things that will change their relationship mostly to their insurance carriers. Insurance carriers will no longer arbitrarily be able to deny insurance based on a prior condition.
Right.
They will not be able to stop insurance because of a serious, expensive illness. and they won't be able to stop insurance based on what is a lifetime of payment. These are incredibly good
These are very
protections
important,
for
long
patients.
overdue,
Yes.
and very good for the country
Right.
at large, for patients specifically.
And I think when patients, and they are things that patients are deathly afraid of. People are afraid of having their insurance canceled.
Right.
So when those things play out in the early part of the bill, in the bill's history, patients are not going to want to see that go away.
Right.
Another reason why I think repeal and rescind is not really possible.
Right. When I was first interviewed by the American Medical Association for the JAMA job, which was in 1981, I was told by a senior staff person there that the most powerful position in the AMA is the president-elect position because he's on the way up. What do you think? You don't feel the power quite yet?
It's not flowing to me yet, George. I don't know. No, I think that the way the AMA is set up, the chairman of the board has most power. The presidents are to enunciate and articulate
Yes.
policies that are established by the House of Delegates of the AMA.
Of course.
So that in a very real sense of the word, we are the mouthpiece for the organization. It's important that president-elects don't feel they're making policy.
Right. No, I do understand that. And of course, the members come first, and we wish there were more of them. And I'm hopeful that maybe you can do something to get even more doctors to join the AMA.
I would love it.
Okay, we've been talking with Dr. Peter Carmel. We've been privileged to talk to him, the just elected president-elect of the American Medical Association. Thank you so much for being with us.
George,
Best
thank you.
of luck as you go forward. Let us know if we can help getting the message out. We have a lot of listeners and a lot of readers and viewers. And thank you for being with us. I'm Dr. George Lundberg, editor-at-large for MedPage Today. And don't forget to give us your comments after you've listened and watched this program. Thank you.